Welcome to T's Voices, telling the stories of the people in our NHS community.
Good morning, this is Colin O from Hospital Radio Stitch, and this morning I have in the studio with me Rebecca Wilson, who is a breast surgeon here at North Tees. Good morning, Rebecca.
Good morning. Thanks for having me.
That's fine. So, Rebecca, tell us a little about yourself and how you became a breast surgeon.
I'm from Sunderland and decided from quite an early age that I'd like to go into medicine. Prior to that, I actually wanted to be a vet, but I decided maybe I'd work with people instead. I went to Newcastle Medical School and then started as a foundation doctor here at North Tees in Hartlepool in 2008. I did a breast surgery rotation and really enjoyed it, both the technical aspects and sort of building the rapport with the patients. And I continued on with my surgical training across in Manchester. I did some research looking into breast reconstruction with implants, and I had some amazing supervisors and trainers there who I'm super grateful for. And then returned here with my husband and two boys back to the northeast and started my consultant job here in North Tees, where it all began. And I feel very privileged to have this job, and I love spending time talking to my patients and guiding and empower them through such sort of a difficult time in their life. And obviously they put their trust in me to perform their surgery.
Breast cancer awareness, why is it so important?
Well, breast cancer awareness really helps to educate and highlight the importance of early detection and regular screening. Early stage breast cancer is highly treatable, and awareness campaigns remind people to take action, like self-examination or scheduling mammograms, and also learning about different risk factors for breast cancer. It's also an opportunity to raise funds for vital research into prevention and detection of breast cancer and treatment and survivorship. You'll see lots of campaigns in supermarkets where you can buy t-shirts, and lots of different charities will run different events, not just in Breast Cancer Awareness Month all through the year, but yes, it's just an extra opportunity to raise awareness, really.
We know it is important, but what are the most common signs of breast cancer that people should really be looking for?
So the most common signs are a new lump in the breast or under the arm, as breast cancer can spread to the lymph nodes under the arm, so that's why you can get lumps there also. But you can also have other changes to the breast, such as changing the shape or the size, skin dimpling. Rarely, but you can get changes to the nipple, a little like eczema, which starts on the nipple and spreads out onto the breast. And you can also get nipple discharge, and you really want to be concerned if it's blood stained or if it's very clear. And obviously not all of these changes do mean breast cancer, but any new change should always be checked out by visiting your GP, and they can refer you on to the breast clinic if required. We have a 2-week wait pathway, so most women that are referred from the GP will be reviewed within 2 weeks at a one-stop clinic, where you would come and have an assessment by one of the breast team, usually with some imaging, and get some answers then and there on the day. It's really important to check your breasts, and we recommend that you really check your breasts once a month at a similar time each month. And breasts do come in all different shapes, sizes and textures, so if you examine yourself regularly, you do get to know what's normal for you, and then hopefully you'll be able to find and detect a change quite quickly.
At what age, really, should women start getting mammograms?
In the UK, the National Breast Screening Programme starts at the age of 50. That's for women of average sort of population risk. There have been some trials to perhaps bring that earlier, and in the future we may start breast screening at 47. If there's any women with family history and who might be deemed higher risk, they can be eligible to start mammograms a little early. So it's important, if you do have a family history, you can self-refer to the family history, and for women local to this area, you can self-refer on the website to the genetics clinic.
So is breast cancer only a concern for women?
No, it's not. It's much, much more common in women than it is in men, but men can still get breast cancer too. And although it's rare, men should still be aware to check their chest area for any unusual changes, any lumps or changes to the nipple. And again, seek medical advice from the GP and a referral to the breast clinic if there's anything abnormal there.
Right, Rebecca, well, thank you for that. But before we go, I do believe you've got something else you'd really like to get over to our listeners.
Yes, I'd just like to say that actually, of course, early detection does save lives, but we also have to remember that there's many people living every day with the effects of breast cancer or with secondary breast cancer, and it's also important to raise awareness of this, and as clinicians and researchers to try and develop ways to improve quality of life after and with breast cancer.
to finish off with, what's one message you would like to leave our listeners with today?
I'd just like to say, don't wait. Early detection really does save lives, and get to know your body. Self-examination is key, and keep on top of screening. If anything feels different, trust your instincts and get it checked.
Right, well, no doubt we will be speaking to you in the future. Rebecca Wilson, thank you very much.
Thank you.
Thank you for joining us. Till next time, you've been listening to T's Voices.